Okay, we kind of got cut off there. I hope everybody's back. Lovely technology, huh? Well, anybody, I am Anastasia. I'm the nurse here. I know some of you that are watching now have been here. So hello, and hello to everybody that's not been in here. I'm going to be doing a treatment here on Stacy, the RF Microneedling, and this is Rich, who's going to talk a little about the Genius before I get started with doing my treatment on Stacy.
Yeah, so I'm just going to jump in real quick. Obviously, Dr. McGarry looked at numerous systems, made the wise choice of going with Lutronic Genius. There's huge advancements and differences when you compare RF microneedling versus RF microneedling, and the Genius itself is 5 to 10 years way ahead of anything else that's out there. There's a couple reasons why, right? When we're talking about RF microneedling, and what we're trying to accomplish is going deeper in the dermal layer to really rebuild that dermal layer, okay? So again, this is a treatment that has no downtime. You'll be a little bit red for about an hour or so, but the main goal here is to cause large coagulation zones deeper in the dermal layer, in the reticulus dermis and the papillary dermis. The nice thing about this system is, one, I'll start with the needles itself. So there's 49 needles on our tips. Anastasia, what's the show? Yep. And these needles are strictly just the delivery mechanism for the RF energy. Okay. So if you want to think of it this way, what we're trying to accomplish with RF microneedling is rebuilding the foundation of a house. Okay. You know, your support beams, the basement, the building blocks of the house. Okay. That's essential. All these other companies have done a really good job treating the superficial layer, but the real magic happens deeper in the dermal layer. Loose skin, deep folds, ice pick acne scars, stretch marks. That's what we're addressing with this. And the technology that's behind this is far more superior than anything else that's out there. Again, starting with the needles themselves, we're the only manufacturing company that actually builds our own needles, which is very important. So starting from the needles down to the handpiece as well, it's a high torque motor, which means it has resistance feedback. Okay, so the skin's a natural barrier that we have to get through to cause these large coagulation zones that I was telling you about in the reticular dermis and the papillary dermis. Also, the machine has what's called impedance feedback. So not to get too technical with the system itself, you want to have a system that's actually reading the impedance of the skin, because impedance changes every millisecond, right? From when you put needles into the skin to when you're firing RF energy, and being able to have a system that's reading that and being able to calculate, think of it as cruise control, to make sure you get a large coagulation zone in that deeper dermal layer so that you can get, you know, collagen turnover and elastin and rebuild that dermal layer for volume and lifting. So it's very, very, very important to have these three things in a system, and obviously the Genius has all three. So obviously we're going to be treating Stacy right now in her neck area. Sometimes we like to call it tech neck, you know, because everyone's on their phone. But also, if somebody has loose skin around their jowl area, if they want a little lift around the periorbital area, stretch marks, acne scars, deep smoker folds, you know, this is ideal for all of that. So again, no downtime with it. We're working from the outside in. As most systems work from the outside in, we're working from the inside out. So again, you know, efficacy is the most important part. Obviously, when you spend your money on a system, you want results. So having a system that has this technology and the advancement it has is optimal for you as well. So I don't want to take up too much time. I'll let you kind of get to it. And I'll intervene in between it and look at some of the comments. If you have some more direct questions, you know, I'd be happy to answer it. So.
Alright, so I've already numbed Stacy, so I put numbing cream on 1 hour before the treatment, so that way you're nice and numb, and I take all of that off and clean it off really good. That way it's much more comfortable for her. So we'll start the treatment here. So I'm going to have Stacy turn actually towards you a little bit. Yep, towards the camera. Okay, and as I do this, I'm just kind of watching, make sure like the feedback I get, and you know, to make sure that she's comfortable as well. it's just a little button I push and it injects all those needles into the skin. How's that feeling?
I can't feel it at all, actually.
Okay, she just said she can't even feel it at all, so it's good. So I am just treating Stacy's neck. But as Rich said, you can treat other areas. Obviously the face.
Yeah, so you can do it anywhere on the body. Obviously, full face, neck, creepiness in the arms, over the knees, again, stretch marks. So you could treat anywhere on the body with this. So, and again, you can see she has a little bit of redness, which is normal. That's just a little bit of erythema that's happening with her. That's a normal response to anybody. That will subside probably within a half hour, or by the time she leaves actually the office. So again, normal response causing these large coagulation zones, deeper in the dermal layer, rebuilding the foundation of the house is what I like to use the analogy for. So again, it's essential to rebuild that deeper dermal layer because that's where that creepiness and loose skin's coming from, loss of volume. So we're trying to rebuild that to tighten that up again.
Just always have to change the setting for each one. Okay. So I just treat sections at a time, and I do 2 passes. The first pass goes in the deepest, and then the second pass is a little more shallow. And I know you probably can't see the color of her skin right now, but it is getting nice and pinkish reddish, which is what we want. How are you doing comfortable-wise?
Mm-hmm. It's fine.
Okay. What would you say on a scale of 1 to 10?
Like a 2.
Okay. So right now she's saying it's like a 2 out of 10 on a pain scale, which is pretty good.
Sometimes I get the, sorry, I just kind of keep
No,
going right back into the picture, but sometimes I get the question that's asked, well, what's the difference between this and regular microneedling? And a short answer is just simply with regular microneedling, you're getting a 1-for-1. The size of the needle is the size of the injury. And when you have an injury into the skin, your body's going to heal that and reproduce new collagen, and so on and so on. So that's not the goal with this, right? When we're actually delivering the RF energy, we want a 5 to 7 times larger coagulation zone or injury than the needles themselves, okay? So the response from the RF energy in that coagulation zone is really what's separating itself from anything else that's out there. With regular microneedling, you're just poking holes in the skin, trying to get some turnover. With this is a whole different ballgame. So,
and it would appear that this is more comfortable for people than regular microneedling.
And again, regular microneedling is going to be more superficial, so you're not going to be addressing really where the main concerns are for people coming in. And there's bleeding and a little bit of bruising with that. This is a clean, smooth delivery system.
Mm-hmm.
Again, when I talk about working from the inside out, not the outside in, that's what I'm referring to. So,
You still doing okay?
Mm-hmm.
any of you have questions, feel free to type them out, and we'll answer whatever you might have. Pull it a little bit. So I'm just going to have you turn towards me a little bit. Thank you.
So there was a question as far as, do you typically need more than one treatment? And ideally, a series of 3 treatments is protocol. Not to say, after one treatment, yeah, you're going to see results, but for optimal results, you want to do it in a package of 3. So that's ideal. And the reason for that is, one, that we want to make sure that we're hitting the full thickness of the dermal layer. She can do multiple passes in one treatment like she's doing now. It takes about 4 to 6 weeks for that deeper turnover that's deeper in the dermal layer. So usually every 4 weeks you could get your next treatment, but a package of 3 is ideal for a 3-series treatment.
Feel a little bit more on the scar.
So I'm paying extra attention to Stacy has a scar on her neck, a surgical scar. So I'm just going over that, making sure I get that really well because this is good for scars. Okay, you want to just turn towards me a little bit more? Thank you.
Another question came in, does this also work on the lines on the upper lip? And yes. So if there's lines anywhere on the body, this is going to work. Okay, so again, those lines, depending on the depth, obviously you would have to see how deep they are. If they're more superficial, the treatment might be more of a superficial treatment around the lip area. But yes, it's ideal for repairing and rebuilding the skin and dermal layer on that addressed area of where the lines are. So it's actually ideal for that. That's the whole purpose of this as well, is, as we age, lines start coming out. They start becoming more noticeable as well. That's because, as we age, unfortunately, we start losing the elastin and collagen, right? So when we cause these injuries that are large enough in the skin, it's actually going to produce new elastin and collagen, and again, rebuild that layer of skin to help repair and cause the collagen and elastin turnover. So.
So then, some people were also asking me about how long, how long does this last? Like once you get 3 treatments.
Yeah, and that just varies on the patient as well. Unfortunately, we can't stop aging, but we can certainly slow it down, right? So if they take care of themselves, they're not, tanning out in the sun every single day, and they're taking precautions, it's going to last a long time, right? As long as their body starts slowing down again, Now you could do some maintenance treatments if you like, but again, to turn back the clock a little bit, that's what we're doing here. So it just depends on the patient, kind of the severity of what their issues are, and how they actually take care of themselves afterwards. So. And again, I keep getting the question, it does work on all areas of the face. Another question as far as the turkey neck, it's ideal for that. I call it tech neck. I think it's a little bit of a fancier term now, just instead of calling it turkey neck, but yes, it's ideal for that. So, and that's actually a little bit what Stacy's getting treated now. Not that she has that, but it would be a similar treatment to what she's getting right now.
Another thing, we get a lot of people that want to know, can everybody do it? Is there any problems or limitations, those types of things?
No. Obviously, if somebody has stretch marks and they're pregnant, I won't treat them. But
right.
Other than that, no. So you could do it year-round on any skin type. So, yeah, there's no limitations as far as that goes.
Second pass. So, I mean, as you can see, I'm almost finished already with her neck. It does not take very long at all.
So I seen a comment on there, as far as again the neck and the jowl area. And when we talk about tightening and lifting that, obviously surgery, a facelift is much more, it's an actual, you're undergoing a procedure and you're removing actual skin. Again, this isn't a facelift, but what we're doing, if you want to think of it, is if you lost air in a balloon, right, we're blowing it back up. So rebuilding that dermal layer, right, is going to help with the loss that occurred from aging or whatever it may be, to put volume back in there, right? It just is going to lift and tighten the skin. Instead of, where surgery is, you're actually cutting and pulling up and removing the skin. So.
Okay.
I think she's all done. So she's a little bit red, which is good. That's a good response. You're going to feel like you have a little bit of a sunburn in that area, which is totally normal. That's the joules, millijoules that we put into the skin. And then, within 4 to 6 weeks, and then even after that, it's just going to keep healing and turning over, and you're going to see great results. It's a really good treatment. So I don't know if she could turn that way a little bit so you kind of see where she treated, but perfect.
Yeah, I don't want to pick up the phone and move it because I don't want it to cut off the feed there. But yeah, she's nice and pink, reddish, a little bit of edema, which is all normal, swelling edema. But the treatment was good, and she, I don't know, what would you say the pain?
I would say it never got above a 4 out of 10.
Okay, she said it never got above a 4 out of 10, and I think that the worst was where she had a scar. Where she has a scar, so we were just treating over that scar a little more aggressively to try to get that to go away. So.
And again, there was a question asked if there's bad bruising or bleeding, and again, when I talk about the technology and the motor and the handpiece and how we're delivering the needles themselves and the energy, Again, we're working from the inside out, not the outside in, so there's going to be no collateral damage on the outer layer, right? We want these injuries occurring deeper in the layer. So no, you're going to have some redness, some erythema. That's normal. That'll go away probably within a half hour. That's going to be completely gone. So, to the bleeding, should be no bleeding. You might get 1 or 2 pinpoint bleeding. If you're on blood thinners, you might want to come off this beforehand, or if you can't, we'll just be cognizant of it. But because we're causing these large coagulation zones, that's going to help as well from any bleeding. So just redness. That's it. That's the beauty of the system as well, is what we're able to accomplish without the downtime. So.
So it's a good treatment overall.
It was
So I am going to get Dr. McGarry back on here. If you just give me a second. Just bear with me here. I don't see her anywhere on here. No, she's not on here. Here's Sarah McKegg. Okay. It's not allowing me. Oh, there we go. There we go. Sorry for that little delay there.
Hi, so I'm back.
Now,
I didn't hear any screaming. I'm not wearing a mask, just FYI, because I'm segregated off in my office. So as you can see, because we are a medical practice, we do practice social distancing. We take a lot of care about disinfecting rooms in between patients. So we try to keep everything very safe for our staff and for our clients, so you can be comfortable coming in and having any treatment, microneedling, whatever you're going to have. I thought that Stacy did a great job with a patient, and Anastasia did an awesome job. You see, the treatment doesn't really take that much time. The face takes a little longer just because there are more sort of details. The treatment itself is fairly straightforward. For those of you who've had plasma pen treatments, this is way more comfortable.
Yeah.
I've had both. And plasma pen, even we use the same numbing medication as we did for plasma pen. We leave it on a little longer, but this was a much more comfortable treatment for me than plasma pen was. And frankly, the results are better. I've had 2 treatments so far on my neck and face, and I've noticed quite a bit of lift, especially at my jawline and on my neck. So I'm about ready for my 3rd treatment. I'm really excited about it. And for those of you who know me, again, I'm Dr. McGarry. I have really sort of transparent, very sensitive skin. I'm an Irish complected girl. I have no pigment whatsoever, and I tend to be on the pink side. And after my 2nd treatment, which was very aggressive, I was kind of pink for a day or 2, and I don't wear makeup. But if I had wanted to cover that pinkness, I could have easily with just normal foundation. I really wouldn't have noticed. I did get a little bit of swelling in my neck, again, because it was a very aggressive treatment, but it wasn't something that anybody would notice. I noticed it because I knew that it felt a little full. That swelling lasted a day or 2, but it wasn't anything that kept me from going to church or going to the grocery store or whatever. And especially with masks, even if you get a little swelling, nobody's going to see it anyway. So there really is very little downtime. My first treatment was a little less aggressive, and there was no downtime at all with that one. I've kind of stepped away from my computer to do this, so I can't see if there are any more comments or questions. But I think, this has been a short live demo, but as our first foray into virtual open houses, I think we've done pretty well. If you come in late and you missed it, you can obviously rewind this. You can watch it from the beginning as a pre-recorded thing. We'll leave it up on our Facebook page for everybody to take a look at. And for those of you who are online and watching this, we are going to do some extra special pricing just for a limited number of people, and for the next, basically for tonight and tomorrow. The first 5 people that call in and schedule RF Microneedling will get their first treatment at half price. So that is a huge savings. Our normal price to treat either the face or the neck is $900. During October, it's $800. If you're one of the first 5 people to schedule, that first treatment will be $400. So yikes, that's great. If you do your face and your neck together, rather than $1,600 for 2 areas, it's $1,100 during October. So your first treatment for your face and neck together would be $550, which would, if you do both areas. So that's less than we're going to be charging for the face alone, even with our special pricing. So anyways, I will quit nattering on. Anastasia, Rich, you guys have anything else to add?
I want to jump in. Obviously, I kind of want to echo what you were saying earlier too. And believe me when I tell you, obviously I sold the system to Dr. McGarry, but she's very clinically proven. So she wants to see results. And I showed her the before and after pictures, and I was showing her clinical data and histology reports. But she was, prove it to me type of doctor. She was great. We love that. So, we had to treat her, and she had to see results, and it speaks for itself. So, I just wanted to echo that. I get, I don't work at this office, and I sold the system, but I know what kind of physician you are. See your number one goal, and we had to prove it to you, which is why you have to do this now too. So, thank you for letting me come here and talk about the system too.
Thanks for coming in.
And just to remind everybody too, consultations are always free. So if you aren't sure if this is the right thing for you or what we can or can't treat, give us a call, come in. It costs you 30 minutes of your time to come in and chat with either myself or with Anastasia. We're happy to go over everything with you, and we'll be perfectly honest with you about whether or not we think that this is the right treatment for you. So that's out there too. All our consultations are always free. That's not a new thing.
Mm-hmm. Okay.
Appreciate it.
Anything else, Anastasia?
No, I just hope to see you all come in and have this treatment done. It's really nice. So hopefully we'll
Okay. All right, everybody, keep an eye on our Facebook page. If you have not already liked us, go ahead and do that. And we will post follow-up pictures of Stacy as she continues to heal up from her procedure, and you can also come in and see her in person. So meanwhile, call us for your consultation or your appointment, and we'll look forward to seeing you at Revive.
Bye, everyone.
Thanks. Bye.